start up warm up to try to prevent any injuries. First, we'll do an anterior capsule stretch. Basically, you're getting a PVC pipe and just slowly bringing your hands closer and closer together while keeping your elbows straight, and you're just trying to go back as far as you can. It really stretches out the anterior pectoralis, anterior deltoid. So as you can see, slowly move your hand together, do a full range of motion, and then keep going until you can't. We'll do an external rotation stretch. So you can use a broomstick, or in this case, a PVC pipe. You'll grab it on one end, and with the other hand, you're just bringing the PVC pipe towards the ceiling, and that will facilitate a external rotation, but you don't want to lean back and hyperextend. If you can't external rotate very much, then you just don't have a lot of range of motion, but you don't want to try to compensate by extending the spine. If anything, you want to try to lean forward just a tad. Next, we'll warm up our rotator cuff, mainly the external rotators. So infraspinatus, teres minor. You want to keep your elbows at your side, and you also typically you want to have some type of towel, or some people use the foam, the swimming pool noodle foam. But you want to have the elbow a couple inches off of the thorax. And then last, usually just do a horizontal scapular adduction. So you're just warming up the rhomboids, middle trap, and your rear delts. This is a doorway stretch or a pec stretch. You get a really good anterior capsule stretch of the shoulder and pec again. You just have a 90-degree angle with your elbow and you lean forward. Last is an internal rotator stretch, because you're facilitating maximal external rotation. You're trying to bring your wrists and hands as high up your back as you possibly can while pushing your elbows backwards. Pushing your elbows backwards brings the humerus into external rotation, which stretches your internal rotators.